way as we reflect on May is Mental Health Awareness Month. This is WZRD Chicago 88.3 FM. We have with us at WZRD today for an interview Scott Wajda. He is the president of the Client Advisory Council at Trilogy Behavioral Healthcare. Scott, do you still remember how many years did you serve as president of the Trilogy Behavioral Healthcare Client Advisory Council?
How many years? I've served 3 terms. So,
And how often are the meetings? How many times a month, or is it weekly?
it's once a month. We have a council meeting. We also have a town hall meeting once a month, and that's for the Trilogy clients of Trilogy to voice their concerns, ask questions of that we could pass along. If we can't answer them ourselves, then we can pass them along to the agency to be answered.
You mean the administration is also there for the town hall meeting, right?
We do have, yes, we do have one of the clinical executive committee members that is with us during the town hall meetings.
Clinical executive community members. So
Committee,
are they
no, I'm
committee?
sorry. Committee, yes.
Okay. Oh, sorry, I just misheard you. That's all.
Okay.
Okay. So what are some of the problems that the clients would bring to the committee member?
Well, we did have we did a remodel of our lobby, and we they didn't do a they didn't put a handicap accessible door on the clinic, so they wanted that put in, and we were able to take that question to the administration, and we did get a handicap accessible door put on the clinic in the lobby from the lobby entrance.
You said an accessible door or an accessible ramp?
Door.
Door. I see.
With a button on it. Yeah.
Oh,
So,
okay. So at first there wasn't that button, or it wasn't functioning properly?
No, there was no button or there during the remodeling process. There was not one there. So they asked us to ask the question, and we did, and we got a handicap accessible door.
Awesome. So before the person would have to open the door by himself or herself, right? And then try to maneuver in through the door before.
Yes. Yes.
Oh, and now that problem has been resolved?
Correct. Yes.
Awesome. Okay. What activities in observance of May is Mental Health Awareness Month are happening in your area of Evanston and Rogers Park, or even in Trilogy, and are also non-residents of Evanston and Rogers Park permitted to attend if they are open to the public?
Well, I know that we have a diversity and inclusion planning committee that is working on activities for all the cultural activities for every month of the year. Now, because of my work schedule, I am unable to attend those meetings. So I don't know exactly what they're doing for the month of May. And with COVID, we can't do a lot of outdoor activity as large gatherings, I should say, something that they would normally do. So I'm not, I have not heard anything. I'm not getting any emails or anything like that about any celebrations and observance of Mental Health Awareness Month because of the COVID,
So that the diversity and inclusion committee all meet for their work, just seeing if the practices are they're working with best practices, etc. Is mostly in-house meeting, right?
Yes.
I see.
They meet once a week to plan out, the following month
Mm,
of
mhm.
cultural events that,
Okay.
we can do, under this restrictions that we are now.
Mhm. So what cultural events are there? These cultural events like in-house, like in maybe a room in a room or somewhere in Trilogy, or are they Zoom events? Do you have any
Mostly
idea?
Zoom, mostly Zoom events. We did for Black History Month. We did uh, actually, it was kind of like a talent show. It was on Zoom
Really?
in the Beacon, and we had people. Well, we did have some recorded acts, but we also had some people show up at the Beacon, and we were appropriately distanced, but
Uh-huh.
we also recorded that, or it was live on Zoom at the time. Um, so people could come in and do I don't know, a skit or a number that they wanted to do, you know.
Mhm.
So that was part of that celebration, you know.
Was that for just clients in Trilogy?
Yes, that was the only, yeah.
Um,
Yes, what I'm talking about mostly is today is just what Trilogy does for its clients,
mhm, mhm,
and things like that. So
mhm. Are you involved in any of the outreach efforts between Trilogy and the neighborhood?
personally, I'm not. That is something that yeah, I would like to see change in the future, maybe that council could become more involved with community outreach efforts. We haven't, that hasn't been any, there hasn't been any big discussions about that, at least with the council.
Mhm.
Yeah, that is something, yeah, I can bring up and see what we could do, along
That
with, you know.
Yeah, that would be awesome. Yeah,
Yeah.
keep us up to date with what their any recommendations or any changes that they do. That'd be
Okay.
really nice. Mm.
Yeah.
How oh, also explain to our listeners the Beacon Room.
The Beacon is a drop-in center. Its purpose is for Trilogy clients to have somewhere to go, socialize, and there's a computers for their use. They can watch TV. They can just meet up with other Trilogy clients. You can go there to wait for appointments they might have at Trilogy 1400. Um, yeah, so it's basically, there's a snack bar. They can buy things there to eat, and yeah, it's something for them to do during the day.
Mhm.
So
And explain Trilogy 1400. That's the address, right?
yes, 1400 Greenleaf. We, at least I do. I refer to our different. Well, when we had another drop-in center, it was on Pulaski, so we used that
Oh,
address, Pulaski address, the 1400 to refer to the two different locations. But
mhm. So 1400 is that West Greenleaf, North Greenleaf? I'm not that familiar with the geography of the streets.
yes, it's 14. It's a Greenleaf and Glenwood.
Okay, awesome. Yeah, it's a very big building. Do you know the percentage of clients that live in Trilogy and the percentage of clients that do have a place to live but go to Trilogy for services?
Well, number one, there's no 1400 Trilogy, 1400 Greenleaf is not a residential facility.
I see.
It's only it's basically their headquarters. Okay, that's
Mhm.
where the majority of their organization is. They do have other staff offices around the city that service clients,
Oh,
city.
mhm.
But they do have some, they have one group home that is staffed. But no, there's about, the last number I heard was like 2,500. There's at least 2,500 Trilogy clients.
Okay, and they're spread out among all the locations, right?
Correct. Yeah.
And how many locations does Trilogy have?
They only have one location that clients can access. All the other locations are staff offices.
I see.
Get easier for the staff to service the clients in that area.
Okay, like I see. Get it. And then also, what for your client advisory council meetings? Usually, how many attendees do you have? Is there a lot of involvement in the council?
Yeah, we have about 12. We have about 12 council members right now.
Okay. And what are the other positions? Are you the president? Is there a secretary? Is there a vice president? Anything like that?
Yeah, there's a vice president, secretary. Those are the officers' positions. We have two staff advisors. Yeah, so those are the positions at the moment. So.
Nice. Okay. Well, how have public attitudes toward the mentally challenged changed?
How have they changed? Well, I think with continuing outreach, continuing, I know that Trilogy has been present at festivals in the past. Before COVID, they had the neighborhood festivals. Trilogy has had a booth there, so they've been trying to. And basically, it was, informational. Informational. I hate the word Trilogy. This is what we do. Trying to reduce the stigma that's out there.
Yes.
And a lot of the stigma is person stigma, but also community stigma as well. So they have those two things. But and I think as time goes on that public attitudes will change. As more and more outreach is conducted and informational sessions are also conducted.
So has this outreach helped? Do you feel that some of the stigma has been reduced?
I would would like to think so. Yes, I would like to think that it is. I can tell you from personal experience that the more I do, the more the better my recovery is. The more I participate, in life and get myself out there, and I'm involved with St. Mary's. I'm heavily involved at Trilogy, not just at the council level, but going to groups, things like that. And I think that, through, I'll say, especially through St. Mary's, the people there, they see how I was 8 years ago when I first, more than 8 years ago when I first joined, and how I am now. Okay. And then and people chat, people talk, and they might say, well, when Scott first joined St. Mary's, he was this way, Now he's better, or he's improved. And I guess the more that people talk about that, then I think the public stigma, and I think that people have a better understanding, but also a better feeling about the mentally ill. So you can see someone who's improved, and they can talk about it, and they can you say, hey, that guy, I know that guy,
Mhm.
and he's better than he was before.
Mhm. Yeah, well, at St. Mary's, I guess what you're saying is that the more you network with people, and then the more you do, it's almost a part of your recovery. It helps in your recovery. That's what you're saying.
For sure, for sure. Yeah.
And I do remember that you invited Bill Morton and me, Bill Morton, president of the Rogers Park Chamber of Commerce, and me to the Super Bowl party, and we really enjoyed that at St. Mary's.
Yeah. Yeah, we're doing that every year now. It's
Mhm.
nice.
Mhm. Yes. How have employers' willingness to hire the mentally challenged changed? Do you have any insight on that?
Yeah, because Choji does have its own supported employment program
Okay.
where
Nice.
they'll have a employment specialist sit down with the client and go through basically the whole employment process from filling out an application to an interview, practice interview questions, maybe the correct attire to wear to
Mhm.
interview, and then even after they're hired by the employer, the employment specialist will stay with them
Mhm.
and talk about the concerns they have about the job.
Mhm.
Because there's always things that come up on a job for
Of
anybody.
course. Yes.
But now the clients surely have someone they can talk to specifically about employment concerns.
Mhm.
So I think that I think is that, and again, is more and more people take advantage, more and more. Speaking of Trilogy clients take advantage of the supported employment program, that employers will be more willing to hire, as they see the Trilogy clients be more successful
Mhm.
and have success at employment because they have the support of Trilogy with them.
Mhm. Awesome. Do you have any numbers offhand about how many clients Trilogy has helped to obtain employment?
No, I don't have those numbers. I'm sorry, but
Oh, that's okay.
I currently have an employment specialist helping me with my current position.
Mhm.
I know one, so there's at least one guy that's benefit. One
Yes.
client.
Yes, of course. No, that's success. That's a
Yeah.
good example. That's what we need is examples, and you that proves that the program does work. That's awesome. Do you know what are the top causes for mental illness?
Top causes for mental illness.
Mhm.
Well, I know some of it. I know that I've not read into the research, that in depth, but I do know that some of it's hereditary. Some of it does follow families. I know that trauma plays a role, in mental illness.
Mhm.
If there's, it can, I'll say, make my word is enhanced, but I don't think that's the right word. But trauma, enhances mental illness. I believe,
Mhm.
it can make it worse. And depending on the trauma, and there's just all sorts of trauma that's out there. Childhood trauma, adult, what may happen to you as an adult, or it's all, it all factors into the diagnosis of the mental illness and severity, and it just enhances it to a point of, um, some people need, extended services,
Mhm.
because of their
Mhm.
trauma and combined with the mental illness. But to say what causes it, there has been research done, but I do know that the chemical imbalance in the brain is something
Mhm.
that is, widely talked about. So
Mhm. Yes. Uh, Do you have data on how many clients are able to transition out of Trilogy services to lead normal lives?
No, I don't really know that. I do know that I do not, speaking for myself, that, I know I've accepted that I've been diagnosed with major depressive disorder. I will be having, or I have major depressive disorder for all my life. Okay. It's not something that I'm going to escape. It's something that, with medication and talk therapy and case management, it's gotten a lot better. Um, what I do, and that was my choice when I transitioned out of Albany Care. I made the decision to let others help me. You know, other people help me. That meant talking to them. So I talked to them, listened to what they had to say, participated in groups, basically participated in life. So my life is a lot better than it was when I moved out of Albany. Um, but, and I have to continue to participate so my depression doesn't come back or overtake me again. It can overtake me again, but it's my decision, it's my choice to, um, participate in what I know is helping me now. Not, you know,
So what you're saying is that Trilogy is helping you to lead a much more productive life, and then you're staying in touch with Trilogy as for any other support services that you might still need, and that's a lot of that's the way a lot of other clients are still with Trilogy.
yes, they're taking advantage of the services that they provide. Yes,
Mhm. And usually most of these services are covered by insurance, right?
correct.
Mhm.
Yeah, I am with, I have Medicare and Medicaid, so.
So it's you do have an online store. So is that your online store more a source of income, or is it therapy for you, or is it both?
Well, at this point, I have no, it's more therapy because I can't, because nobody's really buying anything. I mean, there's a lot of other people that are doing the same thing, so, I mean, it's, and people from St. Mary's, I talk to them about it and they say, well, it takes time. It just takes time. I only started my store in like the 1st of December last year. So it's very young and new. So yeah, it's going to take time. So at this point, since I don't have many sales, it's more therapy. It's kind of an exercise in acceptance, that's going to take time. And, to continue to maybe put out some more products, design more products, knowing that, right now, I'm not going to get a lot of sales, except that I'm not going to get a lot of sales, and, but I'm not in like dire need, of that income. So that makes it a little easier, because it's just, I'm not needing income from that source,
But you do have to pay for the website though.
Yeah, I do pay for the website, yes. Yeah.
You said that a lot of other people also have the online store. Are you talking about people in general, or are you talking about some of your fellow Trilogy clients? They also use an online store for therapy.
No. I was just talking about people in general, and other people in the world that are doing that thing,
Yes. Yeah,
online
we know.
stores.
Yes, we
Yeah.
know quite a few of them. Yes. Okay, so what are you doing in observance of May is Mental Health Awareness Month, except agreeing to interview with us here at WZRD? Actually, you
Um,
suggested the interview, so thank you so much for suggesting.
yeah, well, you were, uh, yeah, you had put a post on Rogers Park News about an interview that you had done, and
Mhm.
I inquired about, being interviewed. Um, what am I doing in observance of Mental Health Month? I not a lot. I not be I guess one thing I would do is I would say that there is another drop-in center in Rogers Park called the Annexer Center. It's in the Gateway Shopping Plaza, right next to the UPS store. It's open like 7 days a week, and it is open to any person with lived experience. Any person with mental disability can go there. So if you from any agency, it's open to anyone. So
Mhm. Is that part of the annex? Is that part of Trilogy as well?
no, they're a separate organization. They're a separate
Oh,
organization, separate drop-in center, and they're open to anyone from any agency.
oh. And when did they start? Do you have any idea? This is
Oh,
the first time I heard.
I think they've been open 2 years, I believe.
Mhm. Yeah, it kind of seems familiar a little bit, the name, but I wasn't sure what they were doing. Okay, thank you so much for that information. Next to the
Yeah.
UPS store.
Yes.
Okay. So the final three questions is concerning our quarterly issues for WZRD. Our DJs, or we call ourselves wizards, we do non-entertainment, and non-entertainment revolves around issues that we hope that the community brings to us. So we ask any of our interviewees these three questions, which is first of which is what's most important to you, second of which was what is the main problem to address long term, and then finally what problem must be addressed now. So let's go to the first one. What is most important to you?
What is most important to me concerning mental illness, do you say? Or
Just in general, what is most important to you in your life that you feel is most important? What is your main focus that supersedes everything else?
uh, at this moment, recovery. At this
Mhm,
uh, continuing to participate in life, continuing to do outreach like this,
mhm,
continuing to do working with the Trudy Climate Advisory Council,
mhm,
continuing to try to work within the existing or structure, mental health structure that's in place to um, let clinicians know what clients can do, you know,
mhm,
and maybe being an example of what a client or a person with lived experience can bring to a workplace or bring to an agency and assisting the agency in assisting other clients by being a client myself,
mhm,
and in determining what that is. I mean, it's not, I mean, there's a strict boundary at Trilogy, which is necessary and, has a very defined purpose, but working with that boundary to best assist Trilogy to assist clients.
mhm. So you speak of a boundary. Could you describe what that boundary is?
The boundary is between staff and client,
Mhm,
getting too personal, staying, trying to stay completely objective
mhm,
to a point of so that the the staff can best assist the client
mhm.
okay, with the recovery without becoming too involved with the client's life because they have a lot of clients, and they have to basically treat each one. I mean, the same way, but in a different, I mean, the same way as respecting the boundary, but but also to empathize with them, and things like that.
Mhm.
Second, there are peer staff there. They are clinicians, people that have a college degree, but
Mhm.
they identify as someone with a mental illness, and they're allowed to share more of their story with the clients, and to relate to them in a closer way, than a clinician who does not identify as someone with a mental illness, who
Mhm.
is not allowed to um, share their personal stories.
Did you say that? So there are some clinicians that also identify with mental illness and that who are helping the clients, right?
Correct, yes.
Okay. And there are also a peer staff. So that is you, right? Because you're among peers and then you're part of the staff as well, kind of, quasi?
No, no, I am strictly a client at Trilogy.
Uh-huh. I see.
I am not a staff member. Uh,
Mhm.
I am, but the council is um, designed to help the clients bring their concerns to the administration.
Right.
That is speaking with clients, okay,
Mhm.
maybe trying to process things with them so they can better talk to their clinicians, because
Mm.
I
Oh,
mean,
okay.
it's it. Now I found that um, the more I talk about something, the better I am to talk about it the next time. Each time I talk about something or
Mhm.
process something with someone else verbally, I'm able to better verbalize and conversate about what my concern or my opinion better, with someone else. The more times I do it.
So the client advisory council not only brings concerns about the facility to the administration, the council also helps the clients communicate better with their clinicians too, right? Is that what you also,
Correct.
oh, mhm.
Yeah, correct. Yeah, when we talk with them one on one, they they can process what they're talking. They can tell us what's going on. At the
Mhm.
I'm processing it with someone else, so that when they actually talk with their clinicians about this situation or concern that they have, they're better able to communicate it with them.
Mhm. Right. They're getting advice from people who have been in their shoes, at least kind of like their situation, and that helps a lot.
Yes.
Okay. What is the main problem to address long term?
Uh, Main problem, I guess, with I guess stigma would be one. That'd be like number one. Uh,
Mhm.
so, number two would be funding. Money. Uh, was it 2 years ago or yeah, I think it was 2 years ago. I went down to Springfield with One North Side to walk around the Capitol and talk to different legislators about raising the Medicaid reimbursement rate, which they get raised the next time they voted, but that was the first time they raised it like in like 15 years,
Mhm.
and so giving these mental health facilities, either nursing facilities or behavioral health agencies, a raise in the rate, or giving them more grants, allowing them to uh, give either a sliding fee scale to more people or a free ferry services to more people.
Mhm.
Be able to, like I said, process what's going on in their lives,
Mhm.
and getting good support around it. And I think that would make our, Chicago, Illinois, United States, the world a better place.
For sure. So before they enacted this legislation, clients had to pay more out of pocket, and what about now? Do they still have to pay something out of pocket, or is it less? What's the
No,
situation?
the medical. So what happens is the Trilogy, they like for me, they'll bill for my service. Like if I meet with my recovery counselor, then they'll bill Medicaid or the state of Illinois a certain amount, right?
Mhm, mhm,
Right now, the Medicaid reimbursement rate is set at, and I don't pay anything. I don't pay anything out of pocket, none.
mhm,
Okay, but they'll bill the state. And what I'm saying is if the state would raise the reimbursement rate to allow Trilogy to get more money, okay,
mhm,
they would be able to offer uh, more services to more
mhm,
people,
mhm,
or to, it'd be better quality services. And they'd also be able to retain people. You know, all these behavioral health services are, they go through people, on a yearly or bi-yearly basis, based on the fact that therapy and mental illness are probably one of the top. I mean, if you wanted to really look at, what our country and what we're going through, and people need to process this stuff, um, if more services were available, more people would be able to process things and, you know, um, come to um, a resolution or at least with themselves, about what's going on. So the more money would allow more services, better quality services, the retention of employees,
mhm,
which in fact, I mean, uh, some of these behavioral health services, they have people only stay there a year or maybe 2 years.
mhm. Turnover is very high.
Yeah, because I'm the client itself, because the client, I mean, they may get to know a person, you know,
Yes.
and form a bond or a trust with them. Okay.
Mhm,
So if the clinician, starts a family,
mhm,
or maybe they want to go and, get finish off their masters, or
mhm,
they want to start a master's program, you know, and they have to leave, then the client has to start all over with someone new, you know,
mhm,
and
mhm,
they have to retell their story. They have to rebuild the trust. They have to bond again with them.
mhm,
And then sometimes, depending on how long the next person stays, you know,
mhm,
do it all over again, and yeah, a lot of people, I've had this asked of me, yeah, do the behavioral health services, do they like tell you what you want to hear? I mean, these are from people that they're not clinicians. They don't know anything about behavioral health services. All they see is that clients of these services stay for a long time, right?
mhm. Right.
So depending on the severity of the mental illness, people are going to have to be there for a long time. But on the other end of the spectrum, if the clinicians, the staff, were able to be retained, being, they want to, or they are given a good raises, in decent salary, so they can live and they can do what they want. I mean, they can do what they want, meaning they can serve, stay in the occupation that they went to school for.
Mhm,
it would benefit the clients greatly, you know.
Mhm. I understand.
Yeah.
And also you mentioned that if there were more money, then there would be more services. And then also the quality of the services would improve. So by quality, did you mean less turnover, or is there something else in the quality of mental health services that could improve?
Well, yeah, less turnover would be number one.
Mhm.
Number two is the longer you keep people in the same agencies, and then they're gonna be more loyal to the agency. They're gonna want to do better if they don't have to move around so much.
Mhm.
That they're going to bring more ideas and more, back
Experience,
from the trades.
more experience, you mean, like if
Yeah,
they stay around longer.
right.
Okay, what problem must be addressed now?
Uh, I I would think understanding, um, I guess understanding of, if I'm thinking about clients and them out in the community, and if the people see clients in the community, understanding them, they may not have to talk to them, but just understand them, understand what they might be going through. When you see them in the community, or if you're talking with them, listen to them. I mean, that kind of goes for everybody, but just listen to what someone has to say, and objectively, um, just be there, objective, you know. Um, I guess, I guess, other than that, I mean, I guess that's more of a personal thing, but well, I mean, personal to the client, and I mean, me too, but also, reimbursement, that, I mean, that, or the other way that money could be obtained from the behavioral health services is through donations, through, uh, each one has a development, department. And so when they contact you, you know, giving the donations, so they can continue, additional services other than what they can get from the billing of the Medicare. That's all. So I don't know if I know there's probably not exactly a answer to that, but I don't know if it is, but
Okay, so what you said is that there needs to be more money for services, for behavioral health services, and also that if that money can come through the government, then it would be great if people would be willing to donate. And then you also meant that there needs to be more understanding from the public of people with mental health issues, and to be more inclusive and be more empathetic. Is that what you were trying to say in this answer?
I think so. Yes.
Okay.
Thank you.
Well, Scott, Wajda, it was a great honor, and you were very, very insightful in this interview. Provided so much information uh, in um, in our reflection of May is Mental Health Awareness Month. And thank you so much for joining us on WZRD Chicago 88.3 FM. Have a great day, Scott.
You too. Thank you for having me. Thank you.
Thank you.
Yeah.